Judy, first of all, thank you for interviewing me. And I'm Dr. Joe Fontenot. I'm with Community Services for Vision Rehabilitation in Mobile, Alabama. And I have started and am the founder of Community Services. I started with it in 2003. I am personally visually impaired, and I saw that there was a need for services for people whose vision was impaired, and have tried to provide services and to help get the American Academy of Ophthalmology to encourage the use and the provision of services, low vision services for people who don't see well. Low vision is very common in the United States. The main cause of it is age-related macular degeneration, which affects millions of people. And there's a lack of awareness of all the help, all the devices, all the training that is available to help these people function better and better. And we're trying to help make people aware of these services, including making the ophthalmologists aware of the need for them to refer their patients who have low vision to low vision rehabilitation services.
What are some of the low vision devices that would be helpful for people with macular degeneration?
Well, as far as devices that are available to help people with impaired vision, there are many devices, literally hundreds of them. The first thing is just plain glasses. Glasses that you can buy around the corner. And there are different strengths. A lot of people do not understand. You can get glasses that magnify, and they do not have to be very expensive or specially made. You just have to, when you get glasses at your local optometric shop, tell them you need stronger glasses. And they will give you glasses commonly up to a magnifying power of 3.5. But there are glasses available much stronger than that. You can actually get bioptic glasses with the stronger part, the lower part, up to 4.5. Of course, that's a little more difficult to use because you have to learn how to look through the upper part, and then when you want to use the stronger part down at the bottom, you have to bring an object much closer. But there are other glasses which would require a separate pair, not just ordinary glasses, but something much stronger, which you would have to use as a second pair of glasses. And those go all the way up to 40 diopters. Those focus very close, so you have to bring an object up to almost an inch away to allow it to focus. But so there are different strength glasses, different types of glasses available. Some of these you can get through your local optometric shop. Others you have to go to a low vision specialist. But that's part of the devices available. The other commonly used devices are simple handheld magnifiers. And everybody has seen somebody who's got a little small magnifying glass, and they can pull it out and look at something very close. And these are available almost everywhere. You can buy them at optometry shops. You can get them online from Amazon, companies like that. So those are the simple optical devices, glasses, magnifiers. Then there are electronic devices. Now the electronic devices can be much more complicated and can be more expensive too. So you have one of the most commonly used things is called an electronic television type magnifier. And there you have a larger screen, roughly the size of a small television set. And underneath that, you can put like a sheet of paper or a letter or whatever, and you can then magnify that and look at it magnified on the screen. And this can be magnified quite a bit, up to say 100 times magnification. And it's very commonly used. It's very stable. It will last a long time. And it's one of the most commonly used devices for people who have impaired vision.
What are some of the devices you would recommend that are portable and less expensive?
There are a lot of smaller electronic magnifiers that you can use, which are portable, that you can carry with you when you go to a store, when you're out on the street. Some of these are electronic devices that will magnify enough to enable you to read, say, a newspaper or a price tag. And they can be anywhere from just a couple of inches in size to, say, 5 or 6 inches. They do have to be electronically recharged periodically, but there are many of these available, and they're very useful. There are some newer devices available. There's one that's been advertised quite a bit locally called the Arcam, which is an electronic device that you can actually clip onto a pair of glasses, and it will read text to you. You can also ask it to identify something. And so these devices have now improved by becoming much smaller and much more mobile than they were when they were first introduced some 50 years ago. There's one that is about the size of, say, a Mark-a-Lot pen, and you can ask it to identify something or to read text. The main thing about all the devices that are available for people who have impaired vision is that they have to be individualized. Not one thing works for everybody. These devices are all of different sizes, different degrees of portability, and different strengths. And one device does not work for everybody. And very commonly, people will need more than one device. So if they just need something to be magnified, enlarged a small amount, they don't need something massive and strong. If they need something that's very large and complicated, it might be because they have much severe loss of vision. So it has to be different for each person. And that's the reason we try and get people to go to a low vision rehabilitation shop or function where they will be examined, and then a decision will be made about what sort of aids, training, and devices they need to be able to function as well as possible. So that's the main thing to remember. You do not want to just pull up a catalog or go to Amazon and just order something without having tried it out, preferably having been tried out on you by a low vision rehabilitation specialist. So otherwise you might end up buying an expensive device which might not work for you, or it might not be the best thing available.